You're staring at a flight booking screen. Maybe it's a baby moon you've been dreaming about. Maybe it's a family wedding you really don't want to miss. Or maybe it's a work trip that's not exactly optional. Your cursor is hovering over confirm, and then the question hits, is this actually safe right now? So you pull up your phone and start searching, and suddenly every form has a different answer. One says, fly all you want. Another says, don't you dare. And now you're more confused than when you started. Here's the thing, that confusion is not your fault. Guidelines genuinely vary by trimester, by how you're traveling, and by your individual health history, so it makes complete sense that the advice feels scattered. This video walks through each trimester honestly. When travel is easiest, when it requires extra planning, and when it might be worth reconsidering. Plus, exactly what to pack, what to ask your provider, and how to prepare so you can travel with real peace of mind. If this kind of practical, no-nonsense pregnancy guidance is what you need, hit subscribe so you don't miss what's coming next. Let's start with the big picture because there's good news here. The second trimester, roughly weeks 14 through 28, is widely considered your sweet spot for travel. Morning sickness has typically eased by this point, your energy is back, and the risk of preterm labor is still low. The American College of Obstetricians and Gynecologists considers this the most comfortable and lowest risk period for most healthy pregnancies. So if you're trying to figure out when to book that trip, there's your answer. We'll come back to this window in more detail, but first, let's be honest about what travel looks like in each phase. Because knowing what to expect trimester by trimester is what turns anxiety into a plan. And before we go further, let's put something reassuring on the table. Millions of pregnant women travel safely every single year. This isn't a rare or reckless thing to do. With the right preparation, most trips go smoothly. So take a breath. You're not being irresponsible for wanting this. Now, the first trimester, let's talk about it honestly. Miscarriage rates are highest during these early weeks, roughly 10 to 15% of known pregnancies. That's the number nobody wants to say out loud, but you've probably already searched it. Here's what matters, though. Travel itself does not cause miscarriage. That's worth repeating. Flying, driving, sitting on a train, none of these cause pregnancy loss. But the combination of fatigue, nausea, and anxiety can make a trip genuinely unpleasant. Think about it practically. If you're dealing with morning sickness that hits unpredictably, a long flight with limited bathroom access isn't exactly ideal. If something were to go wrong, being far from your own provider adds a layer of stress you don't need. And the emotional weight of being away from home during an uncertain window is real. So does that mean you can't travel in the first trimester? Not at all. It just means being smart about it. Keep trips short if you can. Stay well hydrated, especially if nausea is making that harder than usual. Carry your provider's contact details everywhere. And here's something important. Give yourself permission to cancel without guilt if your body says no. A non-refundable flight is not worth pushing through misery. You can always rebook. Your comfort and your peace of mind matter more than any itinerary. As you cross into the second trimester, the landscape shifts considerably. This is your green light window, and it deserves some enthusiasm. Physically, you're in a much better place. The nausea has usually faded. Your energy is back. Your belly is growing, but it's not yet unwieldy enough to make moving around difficult. Medically, things are reassuring too. Major organ development is complete. Your pregnancy is well established. This is the trimester your provider is most likely to smile and say, go for it. From a logistics standpoint, most airlines allow unrestricted travel up to 36 weeks for domestic flights. And some international carriers set their cutoff earlier, between 28 and 32 weeks. So check your airline's specific policy before you book. A couple of practical tips for this window. Book flexible or refundable tickets whenever you can because pregnancy is unpredictable, even when everything is going well. Choose an aisle seat so you can get up and move without climbing over anyone. And if you've been thinking about a baby moon or a bucket list trip, this is the time. Plan it here. Enjoy it fully. You've earned it. Now let's talk about the third trimester, where caution earns its keep. This isn't about scaring you, it's about being straightforward so you can make good decisions. The risk of preterm labor increases as you get closer to your due date, especially after 36 weeks. Long flights mean prolonged sitting, which raises concerns about swelling and deep vein thrombosis. And honestly, the sheer physical discomfort of being wedged into an airplane seat at 8 months pregnant is something to factor in. There's also a simple logistical reality. You want to be near your birth team as your due date approaches. Being stuck in another city when labor starts is nobody's ideal scenario. Airline policies get stricter here too. Many carriers require a medical certificate after 28 to 36 weeks. Some refuse boarding entirely past 36 weeks. So even if you feel fine, you might not be allowed on the plane. If third trimester travel is unavoidable, here's your approach. Keep it domestic, keep it short distance, and research hospitals near your destination in advance, just in case. Preparation isn't paranoia. It's what smart, capable women do. Now let's talk about how you're getting there, because the mode of transport matters more than you might think. If you're flying, here's the reassuring part. Cabin pressure and radiation exposure at cruising altitude are within safe limits for occasional flyers. That's a fear a lot of women carry quietly, and you can let it go. The real concerns with air travel are deep vein thrombosis and dehydration. Get up and walk the aisle every hour. Wear compression socks. Drink water aggressively and skip the caffeine while you're in the air. Your body is already working harder than usual to circulate blood, so give it every advantage. If you're driving, seatbelt positioning matters. Place the lap belt below your belly, not across it. The shoulder strap goes between your breasts and off to the side of your bump. And stop every 90 minutes to stretch your legs and use the bathroom. Your bladder will thank you, your back will thank you, and your circulation needs those breaks. For international travel, there are a few extra things to check. Some destinations require vaccines that are unsafe during pregnancy, particularly live vaccines like yellow fever. You'll also want to know whether your destination has any Zika or malaria risk, and look into whether local medical facilities can handle obstetric emergencies. This isn't about being fearful, it's about matching your destination and your transport mode to your current trimester and health status. That's the formula for a safe trip. All right, let's get to the part you might want to screenshot, your travel prep checklist. Before you go, get clearance from your provider, especially if your pregnancy is considered high risk. Confirm that your travel insurance actually covers pregnancy-related emergencies abroad, because many standard policies don't. And carry a copy of your prenatal records. It sounds excessive until you need it, and then it's everything. In your bag, pack your prenatal vitamins, anti-nausea remedies if you use them, compression socks, extra water, and healthy snacks to keep your blood sugar stable. Bring any prescribed medications with plenty of extra supply. On your phone, save 3 things: your provider's direct number, the address and number of the nearest hospital to wherever you're staying, and your blood type. That's your safety net, and it fits in your carry-on. Here's what I want you to walk away with. Preparation is not paranoia. It's what transforms a stressful trip into a genuinely enjoyable one. When you've done the homework, you get to relax. And you deserve to relax. So let's bring this home. Pregnancy does not have to mean putting your entire life on pause. Some trips are absolutely worth taking. Some are worth postponing. And only you, in conversation with your provider, can make that call. Nobody else gets to make it for you. The goal of this video was never to scare you out of traveling. It was to give you the honest, trimester-specific information you need so that whatever you decide from a place of confidence rather than confusion. Your second trimester, weeks 14 through 28, is your green light window for the bigger adventures. Your first and third trimesters call for more caution, but they don't necessarily call for cancellation. And no matter when you travel, the checklist we just covered has your back. You're not being reckless for wanting to see the world while you're growing a human. You're being brave and smart and intentional. Your provider is your best co-pilot here. Lean on them. Ask the questions, make the plan, and then go enjoy the trip. You've got this.